face is the index of mind. The man is only half himself, the other half is his expression. Socrates was said to have asked the sophist Hippias of Elis, "What is beauty?" Hippias replied, "Beauty is a pretty girl, beauty is gold, and beauty is to be rich and respected." Socrates was disappointed and said, "They are beautiful, but you do not know what beauty is. The human face is unique yet universal, mechanical yet expressive, modern yet ancient. For over 4 million years, our features have slowly morphed into what we see today in the mirror. A brief stop on the way to who knows what. Faces are ubiquitous stimuli in our daily lives, providing a salient source of social information. To accurately infer others' emotions from their faces is the first step for successful social interactions. Barrett et al., 2019, and deficits in this ability are a critical factor of interpersonal conflicts. Kornreich et al., 2002, reduced social competence. Nienow et al., 2006, and development or maintenance of psychopathology. Cotter et al., 2018. Unlike other areas, aging of the face and skin is visible and of significant cosmetic importance to the individual. Therefore, an understanding of the underlying processes governing aging is fundamental to develop strategies to prevent or slow down such processes. Aging of the face occurs on both a molecular and cellular level. The skin and underlying bone and cartilage structures, as well as fat tissue and muscles, age chronologically and biologically. The anatomy of the aging face. Facial layers of the scalp and face. Skin. Subcutaneous tissue. SMAs. Areolar tissue. Periosteum. The commonly utilized surgical planes are shown in relation to the tissue layers. The face is constructed of 5 basic layers, most evident in the scalp but exists in the rest of the face, with significant modification for functional adaptation. The outer 3 layers of the face behave as a composite unit that moves over the spaces of the 4th layer. Layer 4 is the most significantly modified layer, with alternating facial soft tissue spaces and retaining ligaments. Facial nerve branches also transition from deep to superficial in association with the retaining ligaments through layer 4. Regions of the face. The mobile anterior face is functionally adapted for facial expressions and is separated from the relatively fixed lateral face, shaded, which overlies masticatory structures. A vertical line of retaining ligaments, red, separates the anterior and lateral face. These ligaments are, from above, temporal, lateral orbital, zygomatic, masseteric, and mandibular ligaments. Facial aging. No one can avoid aging. But understanding how we age helps us defy it the best we can. The normal course of aging alters the harmonious, symmetrical, and balanced facial features found in youth, not only impacting physical attractiveness but also influencing self-esteem and causing miscommunication of affect based on facial miscues. Aging of the human face is the result of both superficial textural wrinkling of the skin and changes in the 3-dimensional, 3D, topography of the underlying structures. Consequently, aging is the result of the interplay of changes occurring in the facial skeleton, facial ligaments, facial muscles, facial adipose tissue, and skin. A key unresolved question is how much of the change at each level is intrinsic aging and how much is secondary to the changes from adjacent layers. Among the first noticeable changes are the expression lines and wrinkles, which begin as creases related directly to the contraction of underlying muscles. With more advanced aging, additional signs develop, not due to local contraction of an individual muscle, but rather due to more diffuse movement of a tissue mass, combined with the tethering effects of the retaining ligaments. 1. Oblique and vertical glabellar lines. 2. Transverse glabellar lines. 3. Zygomatic smile lines. 4. Crow's feet lines. Lateral brow ptosis is also depicted. Several factors contribute to the aging face. Skin changes affected by time, genetics, and sun exposure. Fat volume changes, loss in some regions and accumulation in others. Loss of tone of facial muscles and ligaments. Facial bone loss. As skin ages, it loses its elasticity and becomes thinner and drier. These changes result in coarser skin texture and a decreased ability to regain its original form when stretched. Over time, these changes lead to wrinkles, rhytids, overlying areas of muscle contraction. Facial volume changes, bone loss, and the effects of gravity. The plump, vibrant appearance of a baby's face is due to abundant facial fat underlying the skin. As we age, we lose facial fat volume and facial skeletal bone density. These changes combined with gravity and loosening of the facial ligaments and soft tissues contribute to the deeper facial changes we see with aging. In the upper face, these changes are most evident with hollowing of the temples and deflation of the eyebrows. Around the eyes, excess skin of the upper eyelids is coupled with decreased fat of the upper eyelid and bulges in the lower eyelid, resulting in a hollower upper eyelid and baggy lower eyelid. Descent of cheek fat leads to flattening of the cheeks and depression of the transition zone between the lower eyelid and cheek, with creation for infraorbital hollows and a more prominent tear trough. In the lower face, these changes can lead to deepening of the nasolabial folds, marionette lines, formation of jowls, blunting of the angle between the chin and neck, and banding of the neck. The facial skeleton resorbs significantly with aging. This loss of support from the foundation of the face results in retrusion and sagging of the overlying soft tissues. The darker areas denote areas of greatest bone loss. As we age and lose facial volume, the contour of the face changes, causing shadow patterns to develop, while youthful highlights fade. Gaining a better understanding of how the face becomes altered over time may help to decide on the best treatment options to address your individual concerns. Left. Typical youthful features: high cheekbones, full cheeks, and a defined jawline. Right. Common features of aging: drooping skin in the cheek area, flattened cheeks, sagging jawline, fullness between the neck and chin, double chin. The overall effect is the loss of the inverted triangle of youth and results in the triangle or square of the aged face. Aging skin causes: loss of moisture and collagen, lines and wrinkles, drooping skin in the cheek area, increased discoloration, brown spots, and rough texture, sagging skin along the jawline. Fat pad aging causes: hollows under the eyes, loss of fullness and flattened cheeks, wrinkles and lines around the nose and mouth, sagging jawline, fullness under the chin, double chin. Muscle movement/loss of muscle tone causes: lines caused by repetitive muscle movement, loss of fullness and contour in the midface, sagging jawline. Age-related facial bone loss causes: lowered angle of brow bone, which contributes to facial lines and droopy eyelids, larger eye areas, loss of jawline definition, less defined chin. Treatment of the aging face. The art of cosmetic consultations to patients seeking treatment of the aging face is very important. Some patients may only want a few lentigines removed, while some only want a slightly smoother appearance to their skin. Some patients need and will accept a facelift, brow lift, blepharoplasty, and full-face laser resurfacing. Some patients will look much younger and less angry with a few injections of botulinum toxin, Botox. Treatment options. Glogau has prepared a useful classification that helps direct treatment of the aging face. Glogau Wrinkle Scale. The Glogau Wrinkle Scale is a standardized method for describing and categorizing the visible signs of skin aging caused by sun exposure. Here are the built-in descriptions for each group. Glogau Photoaging Classification. Type 1, no wrinkles. Early photoaging mid-pigmentary changes, no keratosis, minimal wrinkles. Patient age, 20s-30s. Minimal or no makeup. Type 2, wrinkles in motion. Early to moderate photoaging, early senile lentigines, visible keratosis palpable but not visible, parallel smile lines beginning to appear. Patient age, late 30s-40s. Usually wears some foundation. Type 3, wrinkles at rest. Advanced photoaging, obvious dyschromia, telangiectasia, visible keratosis, wrinkles even when not moving. Patient age, greater than or equal to 50. Always wears heavy foundation. Type 4, only wrinkles. Severe photoaging, yellow-gray skin, prior skin malignancies, wrinkled skin throughout, no normal skin. Patient age, 60s-70s. Can't wear makeup, cakes and cracks. Glogau Wrinkle Scale can be used to accurately assess the severity of wrinkles and fine lines. This information can then be used to develop a personalized treatment plan that may include a combination of topical treatments, such as retinoids or hyaluronic acid, as well as cosmetic procedures, such as microneedling and chemical peels. Glogau Wrinkle Scale limitations. Subjectivity. The scale relies on subjective assessment, and so the results can vary based on the observer and their biases. Culture dependent. The perception of wrinkles and aging can vary across cultures, making the scale less universal. Limited facial areas. The scale only covers wrinkles in certain areas of the face, and does not take into account overall skin quality. No standardization. There is no universal standard for using the scale, leading to inconsistent results. Only for wrinkles. The scale only focuses on wrinkles, and does not assess other signs of aging such as age spots, sagging skin, or hyperpigmentation. Injectables. The high prevalence of using Botox and fillers to hide the visible signs of aging, like wrinkles, can mean that a visual assessment of the skin is highly inaccurate as wrinkles are masked by injectables. Glogau classification and Ronic treatment options. Glogau Type 1. Topical retin-A. AHA creams, 15 to 30%. Glycolic acid peels, 40 to 70%. Botox. Sunscreens. Education. Glogau Type 2. Retin-A and AHA cream. Sunscreens and education. Gessner's peel. TCA chemical peel, 20 to 30%. Air, YAG laser resurfacing. Zyderm collagen. Other soft tissue augmentation. Botox. Glogau Type 3. TCA chemical peel, 30 to 50%. Combination TCA peels. CO2 laser resurfacing, eyes and mouth. Air, YAG laser resurfacing. Combination CO2 and air, YAG laser. Zyderm collagen injection/soft tissue augmentation. Botox. Combination procedures. Glogau Type 4. CO2 laser. Resurfacing, full face. Combination CO2 and air YAG laser resurfacing. Dermabrasion combined with laser resurfacing C combination CO2 laser and chemical peel, TCA. Phenol peels. Facelift, endoscopic. Brow lift, endoscopic. Botox. Conclusion. The face is arranged in 5 distinct layers, and each layer is composed of specific structures which contribute differently to the appearance of an aging face. An understanding of the concentric layered structure of the facial soft tissues provides the basis for understanding the effects of the aging process, and for a logical comparison of the various planes used in facial rejuvenation procedures. Considerations of the interplay between bone, ligaments, muscles, and fat have to be taken into account to achieve safe, natural, and long-lasting rejuvenative effects. Correction of surface abnormalities without attention to structural changes will not give optimal improvement of the aging face. Traditionally, plastic surgery has concentrated on the aging changes that affect the brows, upper eyelids, lower eyelids, and the lower face and neck. The forgotten cousin in all this has been the midface.